Hello, I'm Bhavana Bathina. I am an undergraduate student studying biology. I work under Dr. Qin Wang in the Cell Developmental and Integrative Biology department. My presentation is going to be about Idazoxan and how it ameliorates Alzheimer's related amyloid beta pathology in the hippocampus. Alzheimer's disease is a neurodegenerative disorder and is the leading cause of dementia in the United States. It causes symptoms such as memory loss and the loss of important mental faculties, causing wandering, getting lost, and taking longer to do normal daily tasks that they used to do. Neurofibrillary tangles and amyloid beta plaques are hallmarks of this disease, though the actual cause of Alzheimer's disease is not yet known. Amyloid beta promotes normal tau protein to convert to toxic tau, and this toxic tau protein enhances the amyloid beta toxicity, forming plaques in the brain. APP, NLG, NLG knock-in mice show amyloid beta deposition similar to humans who exhibit Alzheimer's disease, which is why these are the mice we decided to use in the study. Idazoxan, the drug that we chose to use, is a selective alpha-2 adrenergic receptor antagonist. The precise mechanism of these blockers is not known, but it could have two potential effects. Presynaptically, it can stimulate the norepinephrine system to inhibit the negative feedback of norepinephrine release, or it could postsynaptically inhibit the effects of norepinephrine. In a previous study, we showed that Idazoxan helps reduce the overall amyloid beta load when 8-month-old APP PS1 mice were treated for 8 weeks. In this study, we decided to treat younger mice to see if we could decrease the overall load even more. And we tested Idazoxan in a mouse model of early onset Alzheimer's. We hypothesize that early treatment or around the window of unregulated amyloid beta production with Idazoxan can help in the elimination and reduction of amyloid beta plaques. We decided to use 9-week-old APP knock-in mice that were treated for 5 weeks via intrapleural injection twice a day. The experimental group in this study received 3 milligrams per kilogram of Idazoxan, whereas the control group received saline. These mice were later perfused, and half of the brain was embedded in paraffin, whereas the other half was stored at -80 degrees Celsius for molecular biology. The half of the brain that was embedded in paraffin was then cut in 7-micron sections and processed using immunohistochemistry, which involved deparaffinization and antigen retrieval, and then stained using anti-beta amyloid antibody as the primary antibody and a complementary secondary antibody to induce fluorescence. These sections were then imaged using a Nikon Eclipse NI epifluorescent microscope at 10x magnification. Looking at the results, we saw a great reduction in the amount and size of amyloid beta plaques between our control group and our experimental group. We specifically looked at the CA1 region of the hippocampus to make sure we were looking at the same region in each of the sections that we imaged, as well as because of the effects of the the function of the CA1 region of the hippocampus. It's very important for encoding long-term memories, and that's one of the main side effects that comes with Alzheimer's disease is the inability to encode these long-term memories. Whenever we did analysis, we decided to invert the images, as you can see on the right side, so it would be clearer for us to see and clearer to run analysis and measurements on. Individually looking at the biggest plaques from each, we saw that the control group had bigger plaques with more density versus the treatment group, which had smaller plaques. We quantified these results and saw a significant decrease in the amyloid plaque number between our control group and our treatment group. We further broke down the plaques by the various sizes of the plaques, and we still saw significant differences within each small group. Looking at these results, we concluded that the observed reduction in the amyloid pathology could be because of Idazoxan decreasing the amyloid beta production itself. And we further concluded that Idazoxan can be used as a potential therapeutic drug for the reduction and treatment of Alzheimer's disease pathology. Thank you to everyone here, and I would like to extend a special thank you to May Ida, Dr. Shalini Sagu, who is here with me today, and Dr. Qin Wang.
Wonderful job, thank you. All right, at this time, we will open up the floor for questions.
Sorry.
I see Dr. Estes has his mic off, so I think he's going to ask a question.
So good morning, my name is Robert Estes. I'm faculty in the biomedical sciences program, and I was just curious, could you give an indication of the relative ages of the mice? I think you'd mentioned 8 months, and then in the study you did 9 weeks, and how that correlates roughly to humans?
Yes, so in the specific APP knock-in mice that we used, previous studies showed that there was a spike in amyloid beta deposition between the ages of 2 months and 4 months. So we decided to start treating right after the beginning of that phase to see if we could hit it on the head and start before it deposited.
All right, any other questions or comments? I might ask, I mean, this year, doing research during this year of COVID, I asked the previous group about challenges, but what challenges did you have conducting this research?
I was actually not able to come into research last semester. This is not research that I could have done remotely, so I actually had to take a break. And I was only able to process the brains that we had already embedded in paraffin. I would have liked to run more molecular biology on the sections that we put aside and see if there was any more information that we could have gained from Western blots or ELISA analysis.
Good to know. Yeah, I know that's lots of challenges this year, but still incredible to be able to present here at the Expo some wonderful research. Any other questions from our judges or our audience or comments?
Yes, excellent presentation. I think it was very thorough and it was eye-opening because I study Alzheimer's disease, but from the social behavior standpoint. So it was really cool to kind of see the other side of it. So it's a very generic question I'm going to ask, but what are you thinking in terms of next steps? Like, how do you expect to continue this work? What are your plans?
So definitely we want to run the molecular biology to see if there's anything more we can learn from that. And I think we still did see some significant deposits of amyloid beta in the brains of these mice, even after treatment with Idazoxan starting at 9 weeks. So we were thinking about going forward with possibly starting treatment at a younger age, even with these mice, and seeing if that maybe even completely reduces the amount of amyloid beta and look more towards that direction.
Awesome. Thank you.